Imagine unbearable tooth agony. No dentists, no anesthesia, just primitive stone instruments and raw bravery. Now picture a sharp flint tip boring into a living tooth 130,000 years ago. Feel the rough hands holding you down. Taste the bitter herb poultice meant to dull the pain. Barely effective. Hear the scrape of stone against enamel, the gritty crunch as it breaks through to infected pulp. Your mouth floods with the metallic warmth of blood. Every muscle in your body tightens against excruciating pain. Welcome to Stone Age dentistry, where a toothache could be deadly, and the remedy might be as terrifying as the illness itself. For millions of years, our ancient ancestors actually maintained surprisingly strong dental health. Their diet of meat, nuts, and fibrous plants kept their teeth relatively clean and decay-free. But about 10,000 years ago, everything shifted. The advent of agriculture introduced soft, carbohydrate-rich foods that stuck to teeth and fed bacteria, triggering a widespread dental crisis. The traces of these dental struggles and early attempts at treatment remain preserved in ancient teeth found in archaeological digs worldwide. These tiny time capsules reveal a tale of pain, ingenuity, and unexpected sophistication. Researchers have found that hunter-gatherers had far fewer cavities than their farming descendants. This dental catastrophe led to the rise of the world's first dental specialists, experts skilled in tackling a growing epidemic of tooth decay. But what forced our ancestors into such desperate measures? Let's dig deeper into the painful reality of prehistoric dental care. When humans began farming, their consumption of grains and starches increased. These foods broke down into sugars that oral bacteria thrived on, producing acids that eroded tooth enamel. Without modern oral hygiene, this caused painful cavities, abscesses, and infections that could spread to the brain, sometimes fatally. Here's the shocking truth. Despite our advanced dental treatments, modern humans have worse teeth than our hunter-gatherer forebears. Scientific analysis of ancient dental plaque reveals a strikingly different oral microbiome. Prehistoric mouths contained a diverse range of protective bacteria that naturally defended teeth, while today's mouths are dominated by harmful decay, causing bacteria flourishing on our sugar-heavy diets. The numbers tell the story. Studies show hunter-gatherers had cavities in only 1 to 5% of their teeth, while agricultural societies, including ours, face cavity rates between 10 to 85%, despite toothpaste, mouthwashes, and regular dental visits. Research from the Australian Centre for Ancient DNA indicates that our shift to processed foods and refined sugars created an oral ecosystem overwhelmed by destructive microbes, making it a constant battle for our bodies. Even with toothbrushes, floss, and mouthwash, we're losing this fight, while our ancestors were winning without any modern dental tools. What made prehistoric dental pain especially terrifying was the absence of effective painkillers. A severe toothache wasn't just unpleasant. It could stop eating, sleeping, and hunting, threatening survival itself. Pain demands solutions, and our ancestors were resourceful. The humble toothpick was likely humanity's first dental tool, with evidence dating back over 1 million years. Early humans crafted small sticks from wood or bone to remove food trapped between teeth. Archaeologists have found teeth showing distinctive wear patterns caused by frequent toothpick use. When more serious problems arose, prehistoric humans developed surprisingly advanced treatments. In Pakistan, archaeological finds from 9,000 years ago reveal teeth with carefully drilled holes to remove decay. These early dentists employed bow drills tipped with flint to treat infected teeth. Experiments show these tools could create a cavity in under a minute. Though without anesthesia, even a minute would feel endless. The drilled holes were tiny, just 1 to 2 millimeters wide, targeting specific decayed areas while avoiding the sensitive pulp. This was not random. These Stone Age specialists had enough knowledge of dental anatomy to perform controlled, deliberate procedures. Tools tell only part of the story. The true nightmare lies in the patient's experience. Imagine being the one with no numbing agents, no sterilization, just the raw sensation of stone grinding into your living tooth. The psychological impact alone would be immense. Yet evidence indicates many patients survived these treatments. Some findings suggest early dentists might have used natural analgesics like cocoa leaves in South America or opium poppies in Europe, but most probably relied on sheer willpower and possibly alcohol to endure. This practice wasn't exclusive to modern humans. Evidence from 130,000 years ago shows even Neanderthals attempted dental care. At a Croatian site, researchers found teeth with grooves suggesting toothpick use and manipulation to relieve pain from misaligned molars. This reveals that addressing dental pain was important enough to develop specialized techniques. Despite limited technology, drilling was only half the challenge. After removing decay, prehistoric dentists faced the problem of sealing cavities to prevent further damage. The earliest evidence of such fillings dates back 13,000 years in Italy, where archaeologists uncovered teeth with deep drilled cavities once filled with a mixture of bitumen, plant fibers, and hair. In Slovenia, a 6,500-year-old tooth was discovered with a beeswax filling, a natural substance that softens when warm but hardens at body temperature, creating a durable seal. Beeswax also has antibacterial properties that may have helped fight infection. Other ancient societies used materials like tree resins, plant fibers, and minerals to fill cavities. These substances were packed into holes to keep out food and bacteria, demonstrating an intuitive grasp of dental disease progression. Wait, there's more. Our ancestors didn't just chew with their teeth, they used them as tools. Prehistoric teeth were employed for gripping leather, stripping bark, and holding objects during crafting. Their mouths were workshops. This habitual use accelerated tooth wear, often grinding teeth down to the roots. Paradoxically, heavy wear sometimes helped prevent cavities by removing crevices where bacteria could hide. Not all prehistoric dental care was reactive. Some of our ancestors understood prevention. Though they lacked toothbrushes as we know them, they used intentional hygiene practices. Scientists found evidence of many cultures using chew sticks, twigs from specific trees known for medicinal properties. Frayed at one end, these sticks scrubbed teeth while releasing natural antiseptic oils. Species like Salvadora persica, the toothbrush tree, contain antibacterial compounds in silica, acting as a gentle abrasive. Archaeological evidence also reveals the use of charcoal for stain removal, primitive toothpicks shaped from bone and wood, and abrasives like salt or plant ash to clean teeth. These deliberate practices reflect a sophisticated understanding of oral health thousands of years before modern dentistry emerged. Far from ignorant of dental care, our ancestors developed effective solutions with available natural resources. From simple prevention to complex treatments, Stone Age dentistry covers the full spectrum of dental care. Stone Age dentistry reveals a profound truth about human nature. Even in our earliest history, we were not passive sufferers but problem solvers, innovators creating tools and techniques to alleviate pain. The evidence challenges stereotypes about ancient humans. These were skilled healers with deep anatomical knowledge and remarkable technical abilities, given their limited technology. The irony is striking. Despite cushioned dental chairs, anesthesia, and advanced tools, our teeth are generally in worse condition than those of our prehistoric ancestors. Our modern diet has triggered a tooth decay epidemic that even advanced dentistry struggles to control. Though we've perfected treatments, we've disrupted the natural balance that once protected our teeth. Today's dental visits might still cause anxiety, but knowing what our ancestors endured puts things in perspective. That root canal might not seem so bad compared to a flint drill powered by a bowstring. As we recline in comfortable dental offices under bright lights, we might spare a thought for those Stone Age patients. Pioneers who braved unimaginable procedures without certainty of success. While these ancient techniques seem primitive, they continue to inspire modern science. New archaeological methods expand our understanding of prehistoric dental health. DNA studies of ancient dental plaque reveal startling insights into the oral bacteria of our ancestors. Published research in journals like Nature Genetics confirms a steep loss of microbial diversity in modern mouths, starting with agriculture and accelerating through industrialization. Some dental scientists now investigate whether reintroducing lost beneficial bacteria could combat today's dental problems. Could restoring the ancestral oral microbiome be the key to future dental health? As we look ahead, the answer might paradoxically lie buried in our prehistoric past.